Hi, good evening. Austin Mayor Steve Adler. Got a minute? So we're going to go through the virus numbers, which are uh, fortunately still headed in the right direction, not as quickly as we would like. Um, Nice to be able to get together on Got a Minute when we're not talking about crises and ICUs getting overrun. But we have to make sure we don't get complacent. Looking at numbers on a day-to-day basis may not be as important as it used to be in the past, but masking remains critically important, as well as getting vaccinations. And I'll show you why, and we'll talk about it. Let's begin with the chart that we always start with. And we'll bring in the key indicators for staging platform. You can see that the number of new admissions, 18 yesterday, below the 7-day moving average of 21. That moving average had gotten down to 19, the 7-day moving average back up to 21. You can see it's jumped up here just a little bit. It was up at to 21 now, but it gotten down to 19, 18.9. But here with 18, hopefully that'll continue for us. Still a little concerned. Positivity, it was at 4.3. Looks like it might be going a little bit higher. But the people that are positive now are getting increasingly of a younger age, less likely to end up in hospitals, still just as likely to infect somebody else, which is why we have to wear masks. Number of new cases are 95. That's up from 56 yesterday. 7-day moving average is 97, so we're still below the 7-day moving average, which is good. So you can see the numbers are staying low, still heading down a little bit, perhaps plateauing. But let's go ahead and look at the next chart. This is the one that has the Austin, Travis County numbers. We can take a look at the numbers in the hospitals, just so that we can see that they're continuing to head down. You can see the number that are hospitalized, 170. The 7-day moving average is 177, so we're below that, continuing to move down. ICU people, 55, down from the 7-day moving average of 61. Again, headed in the right direction. Ventilators, 31, below the 7-day moving average of 38. You can see we're closing down the alternate care site, only 4 people that are there. The tough news we have is that we have 802 people that have passed away. That's an increase from the 791 that we had before. So 11 people passed away. One of the reasons, obviously, that the ICU and the ventilator numbers have gone down. That's a lot of people. I just can't wait for us to get more vaccines, and I sure do hope that people continue wearing masking while we move things in the right direction to help ensure that we can continue that work. Let's take a look at the University of Texas dashboard as we head into the weekend, just so that you can see what the modelers are predicting for us. This was updated here on the 17th. So just a couple days ago, pretty recent numbers, 17th. The R factor, 0.75. That's down from the 0.8 that we were seeing, not as low as the 0.6 we had seen a week or so ago. You can see that it's still heading down. Here, the projection for hospital admissions still headed down, but kind of flat. Hospitalizations total number, ICU patients continuing to head down but flat. You can see the R number now gently heading down. That's what we have to hold onto. Again, please make sure that you're wearing your masks. Hey, just want to talk today. There was a announcement from Dr. Escott and Director Hayden that they're beginning to do safe reopenings of indoor and outdoor event spaces. This is the celebration or the prize or the reward for a community that's maintaining vigilance. The website to go to, austintexas.gov/event reopening guide, is bringing back events. This is it establishes new health and safety guidelines for indoor events and new outdoor special events. But if you're doing those kind of outdoor special events, not in businesses with occupancy limits and like outdoor special events, you need to go ahead and get a permit. But they sit down with the organizers and go through their COVID plans and practices, and then we'll issue permits. Most venues and events that are happening now already have safety plans that are in place. This is helping us to establish real community standards that will help other venues and events as they're trying to come back to. So to allow even more events and outdoor venues to be possible to ease back into pre-pandemic life, we all have to remain steadfast in our efforts. But anyhow, so there's the site to go to. Indoor guidelines, basically following the color-coded chart. Outdoor guidelines, you need to get a permit that's required. If you go to that site that we saw right there, let's see if we can actually do that. Let's see if we can get to that site. Here is that website for you. You can see bringing back events, and it has guidelines for people bringing back events. It has hyperlinks you can click on. There's a guidance press release from today's event. Click on that, it'll take you to the new guidelines. Here it talks about the fact that PARD is now re-examining the opening of picnic areas and event buildings, taking a look at special events. Also, public library is going to begin hosting events, facility events beginning in April 1st. The Austin Convention Center able to gear up, I think, to a 25% occupancy. So there is a reward for more and more people taking vaccines. But again, and I can't say this enough, we're not out of the woods, and we have to continue to wear masks in order to be able to hold on to these things. Hey, vaccines, looked like yesterday's sign up went well. Sorry about the glitch earlier in the week. We're now allowing vaccines for folks in phase 1A, 1B, 1C, which is all the way down to 50 years of age and older. And school and child care personnel are also eligible for vaccines. Those standards are set by the state. Tomorrow, we're going to have our pilot of Burger Center as a drive-through vaccine site. Probably 1,500, couple thousand vaccines tomorrow, just to make sure that the operation works well. I've seen what the site looks like. It's impressive. Hopefully gearing back up, get to similar numbers to what we're seeing out at CODA. And we're going to test that here Saturday and then next week. The site can easily handle 3,000 folks a day. And hopefully that's what we're beginning to see. In the meantime, while you're getting vaccines, remember it's just not the City of Austin website that you can get vaccines. There are other places. In fact, most of the vaccines in the area are not Austin Public Health. centraltxvaccs.org/hubs.php, what you're seeing on the screen there, is a place you can go to get headed in the right direction for vaccines anywhere in the city. Next week, we have more sites operating, getting more vaccines out to a larger group of people. We're beginning to relax things up, but trying to hold on to masks as long as we can. That's the best and most important thing we can be doing. I was out yesterday and was real pleased to see just as much adoption as I did, both in businesses and just people wearing their masks. Keep it up. And as we go into this weekend, everybody stay safe and have a great weekend. Good night.